There's a couple of problems with the Bivona trachs, and that has to do with the connector piece. The connector piece is the part where you connect a piece onto it, most likely the vent, but the connector piece does not have a firm backing, so that causes some problems. When you, the plastic part that fits over it, since it doesn't have a firm backing, first of all, if you connect something to it, you'll put it on, and then sooner or later it'll pop off. So you push it on tighter. Okay, but the problem there is that the outer casing gets crimped down, and it gets stuck on whatever it's hooked up to. And then when you go to pull it off, well, first of all, you just have this small piece to pull it off, and it's stuck. And not only that, it's in that child's neck, so it's not coming off. If you do manage to pull it off, you jam it into their neck. So, and plus you're making them cough and cough and cough while you're trying to pull it loose. That's where this comes in handy. This is called the Bivona disconnect wedge. This slides in, you know, it only comes with the new packages of trachs, of the trach tubes. So when you get it, save it. This slides right in between the trach tube and whatever stuck to it. Just put it in between the two, put your thumb underneath, and just push it down and it pops right off. Again, just slide it in between the two, and put your thumb underneath, and pop it right off. Now, another thing that happens with this is that every week we have to change these out. When the child first comes home, they'll have the trach in their neck, another one the same size and type, and also another one size smaller. Now those two are called the emergency trachs. They have one size smaller just in case the regular size one won't fit back in. But when we take this trach out and put the other one the same size in, then we have to clean the one we've just taken out. Now if it's a Shiley trach, we're going to wash it with warm soapy water to get it clean. Then we're going to disinfect it with half-strength hydrogen peroxide for 1 to 2 minutes, and then rinse it with distilled water and set it out to dry. But with the Bivona trachs, they have a special coating on them, an antimicrobial coating, so we cannot disinfect it. But we're going to wash it with warm soapy water, rinse it with distilled water, and set it out to dry. But you have to take off the connector piece, or else it'll grow black fuzzies underneath it. Now they're not very easy to take off, but there's 2 ways to take it off. The one way is to fold it down, fold it in half like that, fold one side over, fold the other side over, and then just pull it off. Okay. I'm going to do that again, because I'm a master. It's not actually that easy. You fold it down, fold one side over, fold the other side over, and pull it off. The other way to do it is called the Bert Holt technique. You slide the disconnect wedge in between the connector piece and the trach tube, and it does not fit very well. So you slide it in and slide it very slowly through, and it'll gradually wedge that off. Okay. But you have to do it very slowly and try to keep it even. And keep in mind, it's not going to be inside the child's neck when you do this. Okay. Then you can take it off and wash it. When it dries completely, then you put it back in. Alright, thanks.